Good evening, everyone, and welcome to the Competitive Applicant IR Match Panel webinar of 2019. My name is Alana Breen. I'm Chair of the Education Committee on the Medical Student Council of SIR. Before we get started, I wanted to briefly acknowledge Shanna Harold, my predecessor, for providing this slide set. I am thrilled to be moderating today's webinar, where we will hear from rising interns about the IR match process. I am joined by 7 medical student graduates who are here to discuss their application experiences, share their knowledge and wisdom from a successful match, and answer questions from the audience, which we will take at the end. Shown here is an outline of today's webinar. In part 1, we will begin by reviewing the various training pathways to an IR residency. In part 2, we will hear our panelist introductions. In part 3 and 4, our panelists will speak about the application process and the journey. In part 5, we will take questions from the audience. Briefly, to ask a question, navigate to the GoToWebinar side panel, where you will see the option chat. You may send a question to SIR staff organizer in private. Again, we will field questions at the end of the webinar. So as many of you probably know, there was a transition several years ago to move away from the IR fellowship and instead create an integrated residency program in the match. As you can see, there are 3 main pathways to the IR residency training. The main residency program that medical students are applying to is the integrated IR residency pathway, pictured here on the left. And this is where students apply during the match, typically in their last year. This pathway is a combined IR and DR program, and it's broken down as shown in the graphic. The independent IR residency is an option for students, particularly those students who are in DR residency, but whose programs do not have an ESIR pathway. In contrast, there is another pathway for students at schools that offer the ESIR pathway, where students may complete select IR training during their DR residency years, effectively shortening the final IR training requirement from 2 years in the independent pathway to 1 year, as shown in the ESIR pathway. So to sum it up, the main difference between the independent and ESIR pathways is the length. And there is a separate independent match for those. The applicants here today with us applied to the integrated IR-DR residency match as featured on the left. So we will now move on to the panelist introductions. I'm really pleased to invite all of our stellar panelists here today. And Lauren, why don't you start us off?
Great. Thank you so much for inviting us to speak on the panel. My name is Lauren Park. I'm currently a 4th year. I still haven't graduated yet. This Sunday will be my graduation. I'm a 4th year at Brown Medical School. I will be matriculating for my categorical Georgetown IR-DR residency. And Ilana, did you want us to share our fun fact? Was that part of the question that you initially asked us, or should we save that for later?
Absolutely. Now would be a great time to do that.
Okay. So fun fact about me is that I studied film in undergrad at UVA. So I actually do enjoy sitting in a dark room and looking at the screen. But I also enjoy the production of film. So these two in combination really paralleled my love for procedures and also listening to patient narratives that are imperative to interventional radiology.
Great, thank you, Lauren. And now, Malika, would you like to share with everyone your path to IR?
Yeah, of course. Hi, everyone. I'm Malika. I'm graduating from Chicago Medical School next week. Well, hopefully. I'm kidding. And I'm going to Stanford for the integrated IR-DR residency and Virginia Mason Seattle for surgery prelim. I guess for the fun fact, actually not very fun fact, I'm still doing my sub-I medicine. I would not recommend doing that after a match, but I'm trying to enjoy it. And
wonderful, thank you. Jagdishwar?
Hey everyone, I just wanted to say thanks to Alana for organizing this. I'm Jag Sandhu and I'm a graduate of the University of Miami. and I will be doing IR/DR at Jackson Memorial Hospital and the University of Miami. So a fun fact about me is growing up, I participated in Bhangra, which is an Indian dance, and I competed with a lot of my friends growing up. So that's my fun fact. I'm excited to be here. Thanks again, Alana.
Thank you so much. Caleb?
Hey, Alana, thank you. Really excited to be here. So I'm Caleb Bush. I'm graduating from the University of Kansas School of Medicine, and I'll be pursuing ESIR at Emory after matching diagnostic radiology. And I'll be completing a surgical internship at a community hospital in Riverside, California. My fun fact, one random weekend in third year of medical school, I played my violin at 13,000 feet after making a road trip 12 hours to Wheeler Peak, New Mexico, and lugging it up on my back, and then driving back the next day to make rounds on Monday morning.
Wow, that is quite the tale. Thank you so much for sharing. Avi, would you like to introduce yourself?
Hi, yeah, thanks again so much for organizing this. My name's Abhi. I just graduated from UC Davis School of Medicine in California in Sacramento, and I'm going to be integrated IR at UCSD in San Diego. I'm doing my prelim surgical year at Kaiser LA, Los Angeles. One fun fact about me is I grew up playing the drums in my dad's band, and then I also had a hip hop and rock band my year before med school and played at a bunch of different bars around San Francisco.
That's an awesome fun fact. Thank you so much for sharing. Christian?
Hey, Alana. Thanks again for organizing this and letting me take part on the panel. So my name is Christian Pecoraro. I'm from New Jersey. I recently graduated last week from Rowan School of Osteopathic Medicine. I matched IR/DR at the University of Rochester, and I'm completing my surgery internship at Maricopa Hospital in Phoenix. And then quick fun fact, I'm a big traveler, and I actually recently got back. I spent 2 months out in Italy. So I finished my last rotation, had match day, and then I came back like 2 days before graduation.
Wow,
So,
what a whirlwind.
yeah,
Congratulations on graduating.
thank you.
And last but not least, Julia?
Hi, thanks so much for organizing and inviting me. My name is Julia D'Souza. I just graduated from University of Pennsylvania, and I'm actually staying for their integrated IR/DR program. I'm also staying in the Philly area at Einstein in Philly for a Gen Surg prelim year. And my fun fact is I'm actually one of 5 kids in my family, and I have a twin sister who will also be in the area for the next few years. So I'm pretty excited.
Wonderful. Thank you so much. Again, a warm welcome to all of our panelists. We're all really grateful to have you here, particularly during graduation season and as we near the transition to internship and residency. Congratulations to all who have already graduated, and an early congratulations to those who will be graduating imminently. So without further ado, we're going to go ahead with our first question. The order of the panelist speakers is listed at the bottom using the initials of our panelists. So since we don't have video for our listeners who want to keep track of who's speaking, that feature will be on each slide and will indicate who's talking. So Lauren, why don't you start us off by answering briefly, how did you decide that you wanted to specialize in IR for your career?
Great. So I took a gap year between undergrad and medical school. And during the gap year, I worked as a scribe in an emergency room. And I kept hearing ED docs consulting for IR for all these difficult patient cases. And patients were somehow magically getting treated and fixed with their issues and coming back to the ED to be sent home. And so when I started medical school, that was the first specialty that I just wanted to learn about. So the first month of first year of medical school, I reached out to my now mentor at Brown and shadowed him. And that day I saw the IR team save a woman's life from postpartum hemorrhage, and I was completely sold after that. And just in general, really IR combines for me at least, all the factors that I'm looking for in a specialty: latest technology in medicine, mastery in image reads, procedural finesse, and also clinical patient care. So I feel very fortunate to have found this specialty and have been pursuing it since really the first year of medical school.
Wonderful. Thank you, Lauren. Malika?
Yeah, sure. So when I started my third year clerkship rotation, I think like everyone else, I was trying to figure out what I want to do. And every rotation, I had an opportunity to get exposed to radiology, diagnostic radiology somehow. And I really loved the visual component of radiology in every rotation. And medicine rotation, we had a patient went to cath lab. I went with the patient. Of course, I love doing procedures. So like it was the first time I was exposed to IR. And then the more I learned about IR, the more I realized that it's basically like a collection of everything I love about my clerkship rotation. But at the same time, it doesn't have the things that I don't like about like the rotations that I had done by that time. But I wasn't sure at that time yet, so I took a research year between my M3 and M4 year. I did research in radiology and IR, and at the same time had the opportunity to explore the field more. And again, I really love the creativity and innovative nature of the field, and it's just like a perfect combination of everything I love about like all the every rotation and the medicine. And that's how I got interested in IR.
Thank you for sharing. Jag?
Great. So for me, like as I was going in a third year, I was pretty sure I wanted to do something procedural, and it was actually at the beginning of my third year of medical school. I was on my surgery rotation, and while in ACS, we referred a ton of our patients to IR, and I would go down and follow up on them. And two of the interventionalists down there kind of took me under their wing, and from them I was able to learn a lot about the specialty because I hadn't really known anything about it prior to that point. And my interest kind of grew from my relationship with my two mentors, and then I kind of saw like everything that IR can do, and kind of growing up in this age where like there's a lot of video games and stuff. A lot of what I thought was very cool about the procedures, to me it seemed like it was kind of playing a video game. And from there, I kind of saw that this was a field that I really wanted to do. And it was like the combination of procedures and clinical medicine that I really liked. And the technology, I think, in IR is probably the coolest, pretty much up there with like neurosurgery.
Wonderful. Thank you. Caleb?
So I kind of a non-traditional introduction to IR. I took a gap year between my second and third years of medical school to do research in Japan. While it wasn't IR research, I fell and broke my clavicle snowboarding, and I had to have surgery in Japan. And the snowboarding out in like rural Japan, the doctor there didn't really speak English, and so I came across this profound kind of feeling in radiology where we could communicate together without necessarily verbal language, but rather through images, that I could see the fracture on the x-ray. And so after returning to medical school my third year, or to begin my third year, I shadowed into radiology, and then interventional radiology is where I found the marriage of grace of movement and sharp wit and equanimity. And those are kinds of, the hands-on skills that I think I'm particularly inclined towards, especially since I was considering surgery coming into medical school.
Thank you. Albie?
Hey, yeah. So for me, yeah, kind of, I figured it out my third year actually on my internal medicine rotation, mostly through shadowing in the beginning. During the third year, we don't really have a radiology rotation actually. So I met a great mentor at the VA where I was rotating on IM. He kind of took me under his wing, kind of got me involved very early. And then I think what was most notable about the experience was that, yeah, I enjoyed it, but I had the opportunity to do my surgical and psychiatry rotations at that same hospital with the same mentor. And unfortunately, I was seeing the same patients hospitalized for over 3 months, but they had a lot of care they received from IR, and I got to be a part of that whole experience over a continuous amount of time. So I think what I really enjoyed about it is I thought IR was a perfect marriage between all 6 rotations I did my 3rd year. I enjoyed every single one of them, kind of like Malika was saying. And so actually the IR that we worked with who was called the honorary member of the surgical team, would round with us too in the mornings as well. But I think what I realized from that experience was that I could be a head to toe expert on disease, which I really appreciated. As an IR, you can diagnose, you can provide therapeutic care, and you can also provide palliative care as well. And I thought that was really crucial to the entire patient experience. And so that's why I ended up choosing IR.
Thank you. And Julia?
Hi, sorry, I was muted. So I actually came into IR. Came into med school really interested in a procedural specialty, and when I was on my surgery clerkship, had 2 weeks on vascular surgery, and that's when I kind of saw how the devices IRs use combined, or endovascular procedures use combined with the imaging and the minimally invasive approach were all things that really resonated with me, especially considering how innovative the field is and how much new technology and new devices it uses. So I really liked those aspects. And moving on from there, when I went into my internal medicine clerkship, we had a lot of consults down to the IR suite, and I was able to go with some patients to see a bigger range of what IR does. Similar to what Abby was saying, I really, really appreciated how IR has such a wide range of diseases they treat in different systems. So moving on from IM on OB-GYN, when we talked about UFIs, all of that was just really exciting to interact with all of these different patients and kind of find really elegant ways to treat a lot of different diseases. Like, it was really neat procedures, but also really interesting pathophysiologically to kind of hack diseases and think about them in really interesting ways. So I liked those, as well as really enjoyed my time on DR. I liked being in the reading room and visual. I'm a pretty visual person, so I liked DR and IR for those reasons as well. And in general, like how innovative the field is and the mission of making things more minimally invasive.
Thank you, Julia, and to all of our panelists. From procedural finesse to innovation and technology, minimally invasive therapeutics, continuity of care, diversity of pathologies encountered. There's really a lot of wonderful reasons you all mentioned as to the drivers of your IR inspiration. So thank you for sharing. We will now move to part 3 of our webinar, The Path to Becoming a Competitive Applicant. So this will cover everything leading up to the application trail. And our first topic is about choosing IR. How did you first learn about IR, particularly since it's a relatively new specialty in the match? What advice would you give to students who know very early on in their studies that IR is their dream specialty? And conversely, what advice would you give to students who realize later on, perhaps late in their 3rd year or beyond, that IR is their dream specialty? We'll start with Lauren.
Hi, so before I start answering any questions, I just want to let everyone know, if you have any questions that you'd like to ask the panelists, please address the questions not just to the organizer, which I think is the default setting, but send it out to organizers and the panelists via the question section, not the chat section. So I think I spoke about how I first learned about IR, and I can probably touch on the second question more than the third question. So if you are really lucky, like I was, to find out about IR very early on in your medical school career, then I think this is a great opportunity for you to get involved with national leadership like the Medical Student Council and SIR, as well as the local chapter of IR interest group. If there isn't one, definitely work with your IRs at your institution to create one. I think that shows great leadership skills and also open up a lot of doors for you to network with at least IRs in your region. And also for you to start a meaningful research project. So I think those are the extracurricular activities, if you're interested in IR, to really go for, because getting involved on, in either local or national leadership will help you to learn more about IR from peers who are interested in IR as much as you are, but also create a special, mentorship with the attendings that you're working with, not only in your local IR department at your institution, but also there are a lot of academic focused IR faculty on a national level working with medical students on RFS or on medical student council who will mentor you. So I think all those leadership experiences are great, not only to show your leadership skills and develop them, but also develop meaningful relationship with your future colleagues. And I'm sure I did small research projects here and there. And I'm sure between all of our panelists that they will be able to share more in depth about the meaningful research projects that they have done. But I think research goes a long way as well on your application.
Great, thank you, Lauren. Jug?
Yeah, so basically I would just echo the same thing that Lauren said about joining your local IR interest group, becoming a member of SIR. I think it's free for medical students to get involved with that. And then also applying to join the RFS or MSc. And something else that she didn't mention, I think if you joining the IRIG, you'll get to meet a lot of your upperclassmen who either are applying or have applied and are interested in IR. And I think they're a pretty invaluable resource that you can use because they've kind of laid out kind of a map or tried to lay out a map of things you can do your first couple of years in medical school to kind of guide you towards IR. And then the big thing about joining your own IRIG is it'll give you a good opportunity to get to meet the faculty at your institution in IR. And I think that will be the biggest, one of the biggest factors to help you when you come to apply. And for if you do decide on IR later on, in third year, I think at that point it's really important to just get to know the faculty at your home institution as well as possible, and join the IR interest group when you figure out that that's what you really want to do. And it's never too late to join the MSc and become a member of SIR and get involved in that way. And also the same thing, just talk to your fellow colleagues that have known that they've wanted to do IR for a while and have been going through the process to kind of see what they're doing to help make themselves more competitive. And setting up a meeting during your third year with the program director if there's an integrated residency at your home institution, and kind of seeing things that you need to improve upon, and or what about your app is pretty good, getting a honest assessment. And I think it's very feasible to go into IR if you find out you want to do it your third year as well.
Great, thank you. Malika?
Yeah, so I completely agree with what Lauren and Jack said about research, getting involved. And the only thing I would add is just if you're early on in your training, I would recommend signing up for an IR elective that is done by Dr. Vishal Kumar at UCSF. It usually runs from January to March. It's it's a webinar series, once a week, 1 hour lecture that, and I think this year was the second year that he did that webinar series. It's designed for medical students, so it's at the level of medical students. He covers different topics in IR every week, and he even goes beyond procedure rooms, topics that people should consider when they're thinking about IR. I personally found it very helpful, and it's also part of the SIR-RFS as well, the medical student section. So I think it was very helpful. And then the other thing is just I highly recommend doing research here. Again, if you're interested in doing research, I know, yeah, research here is not required, absolutely, but I personally got a lot out of it and benefited a lot. I'm not going to go into too much details because most people are not interested in taking that path. But if it's something you're thinking about or have a question, shoot me an email and I would be more than happy to talk with you. But other than that, mentorship I think is super important for residency.
Thank you, Malika. Caleb?
I'll speak to the third question since this was kind of me. I didn't get or find my interest in IR until my third year. So if you're a little bit late to the game, what I would say helped me the most is impressing with extracurriculars, whether it be research or getting involved with a student interest group and making things happen. In my case, we didn't have an IRIG group at my school, so I founded the student interest group, and then I also conceived some study. I have a history of playing video games, like semi-professionally, so I immediately made the connection with IR, and then I brought it up to one of the IR docs, who I'd really never met before. I kind of just sent out an email, and he was game to be the PI. And so it really, like, going through the whole motion of looking at video games compared to interventional radiology skills in residence kind of taught me not only how to do the research methodology, like writing an IRB, but it also really helped me to build relationships with the doctors who would be writing my letters of recommendation. And although they hadn't known me, for example, since first year, if you can basically show them that you're extremely motivated and committed to interventional radiology, I think having that research, if it gets published on your application, is great. But I think the most important thing is how those doctors feel about you, and that you can prove yourself to them.
Thank you. Avi?
Yeah, I think these guys covered a lot of it already, but I think 2 points. I think if you're lucky enough to figure it out super early, obviously getting involved with the MSc or your local IRIG research, things like that are important. But I would say that it's really also important to make sure you have products that result from these that you can talk about on your interviews, and also feel proud of when you're done, so you can feel like you had an accomplishment from start all the way to finish. I think it's good to get involved in a lot of things, but it's equally as important finishing the things you start. And the second thing I would say is I think it's easy to get caught up in how competitive the field is, and you need to get your research and your MSc and all these things they start building them. They're very important for sure. But I'd also say, like, before you get caught up in that, make a concerted effort to get to know your home institution department, your home institution DR and IR attendings, residents, and take the time to really learn about the field by shadowing on your own time. I think just so you can really figure out if it's right for you, and if it's in the, if you like a day in the life. I think it's easier to definitely go to the angio suite and start shadowing, especially during your preclinical years. You have a little bit more time than when you start rotating your third and fourth years. Not to say you can't do it your third and fourth years either, but just getting comfortable with the technical aspects as well. I mean, you can always go talk to one of the surgical technicians, the radiation technicians, and learn how to set up the back table, learn how to understand the different types of wires, catheters, set things up. And if you learn that and you want to go shadow, and you know how to do that already, you're going to be able to start working definitely more effectively as an active role in the shadowing process with your attending. They'll start letting you do stuff, maybe, who knows. And I think that relationship that you can establish with your home institution throughout your 4 years, 3 years, or whenever you figure it out in med school that you want to do it is super important for your application process down the road as well.
Fantastic. Christian?
Yeah, I'd agree wholeheartedly with what everyone said so far, and I'd like to echo just getting involved as early as you can. Similarly to what Caleb said, I was definitely late in the game. I didn't find IR until the beginning of third year, and I had to kind of switch gears. And coming from a small school, I didn't have any dedicated IR department. It took a lot of manpower and figuring out and kind of figuring out what I needed to do to get point A and point B. And for those who've listening in and come from smaller schools and maybe doing all their clinics in a community hospital like I did, that shouldn't really deter you. There are ways to go around that and find out what you need to do to get involved, especially with RFS and all the resources that they have available at your disposal. Start there and going to the local symposias and getting involved that way, and networking, joining your IRIG, and if you don't have one, starting one, and getting involved like that. And obviously research projects, really anything you could do to get involved and show that you're committed to IR.
Thank you for that. And Julia?
Sure. So I was also somebody who found IR somewhat, I guess, later in medical school. And echoing a lot of what other people have said, well, one of the first things that helped me make a decision early on was attending a local symposium to really get an idea of what all IR encompasses, to talk to a lot of different people, and I found that very helpful. Definitely recommend just talking to upperclassmen were applying into IR and who tell you a lot of institution specific things about who they recommend working with, what you should be looking at in terms of electives. And then definitely recommend getting involved with your department, like people have said, and forming those relationships and just getting a feel for everything. I, like Malika, took a year out for research and really, really valued that, especially before making the decision to go into a 6-year long training program, to really feel like it was the right field for me, and also to just grow the depth of like what I knew about IR and what kind of path I might be interested in following in the future. I personally am someone who's interested in research, so it was helpful for me in that way, but also just the exposure to the field and getting so much more familiar with it throughout the year.
Thank you. Sounds like, if I can summarize in 2 words what everyone said, it's getting involved, whether it's national leadership, IRIG involvement, meeting with faculty, the UCSF webinars that Malika mentioned. So thank you all for that great feedback. Moving on to our next topic, this slide is for the preclinical years in step 1, and the snapshot shown is from a 2018 JVIR paper about the 2017 integrated IR residency mean and median match step 1 scores, which are shown here at 245. So we all know that IR is becoming a very competitive specialty. In addition to studying for step 1, what other activities would you recommend in the preclinical years? And what advice would you give to a medical student interested in IR who was disappointed with his or her step score? Lauren, we'll start with you.
Yeah, I think numbers are looking scarier every year. I attended the Association for IR Program Directors meeting this past spring, and we were looking at the average of all the applicants, and they do not have a wide range. Everyone's pretty high up there in terms of step 1 score. But I want to say that yes, it's true that there are schools, institutions with definite cutoff of potentially somewhere around 240. But this is definitely not all institutions at all. Even really, top tier institutions that you would think about do not have cutoff for step 1. So Ilana put up the statistics from a paper that she referenced. If you look at that paper more in depth, the most important factor that IR program directors are looking for above step 1 score is actually a commitment to IR. So not to say that step 1 score or clinical rotation grades are secondary or less important. I think they are important. But if you did not do well on step 1, then I think your activities have to show your enthusiasm, not just enthusiasm, but also how hardworking you are for your passion. So in summary, be active in your IR interest group, be active in SIR, either through RFS or through, women in IR committees. Do meaningful research, maybe take a research year like Malika did and Julia did, but do not compromise in academics because of these. I think these are kind of secondary to academics, but these are just as important as well. And also you can try to do better on step 2 and take them early before you send out your ERAS. So those would be my advice. But I don't want anyone to be scared away, especially as a first or second year medical student, to pursue IR just because of high step 1 scores, because I don't think that is end all.
Thank you, Lauren. Really valuable feedback. Chug?
Yeah, so I mean, I just want to echo what Lauren said, like academics is very important. So something that I would say that you could do, that's important to do during your preclinical years. Obviously, if you know you want to do IR, get involved with the SIR and IRIG. But I mean, what do you like? What do you come in like passionate about in medicine? Are you passionate about like public health or community service or different clubs and organizations? There's ways to get involved in different things at your medical school and become a leader in those organizations, and be able to do something that you're proud of. And I think that's important because you can talk about it in your application later on, and it makes you kind of a more well-rounded applicant as well. And you learn a lot of skills through getting involved with different organizations and clubs, like a lot of important leadership skills that you can talk about. So I think other than like studying and getting involved with IR, that's something that I think would be beneficial for people to get involved with. Just find out what you really want to do, or like what organizations really speak to you, and like join them and become leaders in them, and kind of be proud of what you like, do something that you're proud of accomplishing during those preclinical years. So for advice for someone who's disappointed with their step one score, I would say like it's still feasible. As Lauren said, that a lot of programs don't have strict cutoff scores, and there are ways you can improve, like past your step one to make yourself more competitive, like doing well in away rotations, like choosing away rotations. Like we'll get into that later. There's a lot of ways you can improve your app to make yourself competitive, even with a step one score that you might be disappointed in, because there's more to your application than your step one score.
Thank you, Jug. Malika?
Yeah, I completely agree with what Lauren and Jack said, and don't want to repeat them. But at the same time, I think like the only thing I would add is just like if you want to be an interventional radiologist, you will be an interventional radiologist. The only question is just like how hard do you want to work to get there? And again, like the only thing I can add to that is just like if there's anything in your application, any red flag, anything that you're nervous about, that you're not happy about, just like make sure you find a good mentor that you can trust and get good advice. And then that person's not necessarily going to be someone, who like a classmate who just matched. And I speak for myself, but if you ask me a question, I would tell you what I think is the right answer based on my personal experience, which is N01. And it's very different from perspective of like a program director who looks at like almost thousands of applications every year. So again, just like there are a lot of programs that they look at application as a whole, and one score is just like it's not the whole application. So make sure you find someone reliable resource that can trust for advice.
Thank you all for those inspirational words. This is step one can be a real source of stress for students in their second year, before and after. So thank you for emphasizing that a step one score is not the end all be all, which is correct. And it's about perceived interest. As Lauren mentioned, that's the most important factor that many PDs cite. And there are ways to mitigate a score that you may be disappointed with. So, and this step one does not have to be a barrier. So thank you all for sharing that. We'll move on to our next topic, which encompasses IR and DR rotations, general scheduling. So how many IR and DR rotations did you take, and were they home or away? And how many of those rotations would you recommend are IR versus DR or home versus away for our listeners? And when would you recommend scheduling these rotations during MS3 and MS4? Caleb, would you like to start?
Yeah. All right. So I did one DR rotation and 2 IR rotations. Of those 2 IR rotations, one was home and one was away. And the DR rotation was also home. As far as how many I would recommend, at least at my institution, my diagnostic radiology rotation was a prerequisite for IR. And I'm kind of glad it was. I learned a lot of imaging interpretation techniques that really helped me on my IR rotation. And in terms of IR rotations, I think it's important to first do your home rotation to really learn kind of how things work, how tables turn over, or how to help the techs in the angio suite and how you can really be useful to the doctors in the angio suite. And then after completing that home IR rotation, go elsewhere. Maybe you can call this your audition rotation, where you're really, at this point, trying to impress or show off your knowledge to the doctors at an institution that you either are interested in and know you would like to go to, or at a place that you want to feel the environment and see whether or not the personality type, etc., is for you. And as far as scheduling the rotations, I think it's important to do those rotations before you send out your applications, or at least before interview season commences. I did my away rotation in October, and it was a bit stressful because at that time interviews start rolling in, and so I was forced into a situation kind of where I had to check my email intermittently, and you're put in a position where you don't want to leave the angio suite in the middle of a case. So I would recommend, if you can, do your aways before October.
Great, thank you. Abhi?
Yeah, so I did one DR rotation at my home institution, an IR rotation at my home institution, and then 2 IR rotations at away institutions. Just to echo what Caleb said, I do think starting at your home institution is the best bet, and definitely doing DR before you do IR as well. That way you're also getting to know both sides of the story here and trying to understand the foundation of this all as well, starting with diagnostic radiology, because that's, you definitely need to be great at DR to be great at IR as well. In regards to how many I guess I would recommend, I definitely think if you're trying to go into integrated IR as a pathway, definitely doing more IR rotations in DR and definitely doing OA rotations. I think that's really important. It kind of goes back to the data on that paper on the last slide, and it's assessing commitment to the field. And I think, just kind of going through the process myself and talking to mentors I had, the one truly objective way to determine your commitment to the field is truly your understanding of the field as well. And I think that can stem from how many away rotations you did and the quality of those away rotations too. And maybe if you got letters of recommendations from those away rotations as well, those would be helpful as well. But I definitely think they're important in order for you to understand the field better, and then for also to show your commitment and see if this is, it's 6 years long, see if this is something you're really interested in doing. And then scheduling, yeah, so I think ERAS this year was due September 14th or something like that. I would recommend getting these rotations and letters done before that time. Like Caleb was saying, I think it's pretty common if you want to do rotations after that too, and it's definitely doable. I think it might be challenging though if you're like, maybe if you're on your IR away rotation somewhere and interviews start rolling in and you need to leave your sub-I to go on an interview, that might be kind of awkward to facilitate. So I think it'd be easier if you got everything done before apps were in. And then, I think another thing on this is you also have to take your step 2 CK at some point after third year is done. I took mine in May and got it done with, and then did all these rotations. And I thought that was pretty helpful as well, just to kind of get it done, and you kind of have this knowledge fresh in your head when you go into your rotations as well, which I think can be helpful when you're trying to audition and things like that.
Great, thank you. And Christian?
Yeah, so I did 3 IR rotations in total. One of them, which was in an early elective in the winter of my 3rd year at my home hospital. Even though I didn't have a dedicated IR department, I did have some free elective time to be with an interventionalist. I thought this was good, especially because it gave me that early exposure, to actually see the day-to-day grind of what it's like, and to actually be honest with myself and see if I was interested in IR as a whole. And then I had to dedicate some time for step 2 in the summer, and then right after that, I completed 2 IR away rotations in August and September. As far as scheduling and how many rotations to do, I get asked this a lot. And I guess it depends on your individual situation. Obviously, scheduling constraints can affect this decision. Ideally, I feel like that golden number is around 3 rotations total. If you could do at least 2, that would be wise. And if you're able to go for it and do 4, it can work to your advantage in order increasing the number of interviews you get. However, it may be quite difficult, as Avi and Caleb were saying. Once interviews start rolling around, I remember this year was as early as mid-October. When you're on that 4th rotation, it will get really hard to try to answer these emails, leave the suite, and especially got to coordinate all these traveling and scheduling the dates. It gets really tedious and expensive. So be careful with that if you do decide to do 4 rotations. So I would say around 3 plus or minus 1, really depends on your individual situation. If your home institution does have either a DR or an IR residency, definitely complete a home rotation first. It's more familiar. You're familiar with the staff there. It's good to learn in a more structured and safe environment as your home institution before you start going out and only spending a month with an away institution. As far as doing DR versus IR rotations, again, it's really up to you. You do need to be interested in both. If you don't like DR, the training for IR is going to be really rough. But the caveat to this is we have really little time for electives, and you obviously want to increase your chances for interview spots. So you would ideally like these rotations and electives to turn it into interviews. So I would personally err on the side of completing more IR rotations because there's just more opportunity to perform and showcase yourself. However, that doesn't mean that doing a DR rotation is a waste. You obviously learned a lot, and it will translate directly into IR and be helpful for your IR rotations. Additionally, I've heard of classmates and colleagues, they had their heart set on a specific program. However, that program filled up all their elective spots for IR, so they instead did a DR rotation, and that's also a good way to get your foot in the door and perhaps get an interview at that specific institution. And lastly, I didn't personally do this, but if my school allowed me to, I know other colleagues who've their school is quite flexible, and they allow them to swap a 3rd-year core rotation and instead do essentially a 4th-year elective during their 3rd year, sometime in the spring, a little bit early. That would be great too. Again, this will allow you early exposure and even a possible letter of rec, especially before the ERAS applications go out early September.
Great, thank you. So just some quick bite highlights here to try and first do home rotations, try and get them done before October, first do a DR, try and take step 2 CK early, and strive for about 3 rotations if you can. So moving on to IR and DR rotations, the rotation itself. What is the best way to prepare for an IR clerkship, for a DR clerkship? How do you get the most out of the clerkships while you're there? And are there any specific recommendations for students hoping to ask for a letter of recommendation based on an IR clerkship and based on a DR clerkship? Julia, would you mind getting us started?
Yeah, of course. And I just wanted to add something about the last slide and scheduling and planning. I actually did one away, which was in October, and I agree with what multiple people said about the difficulty of having your interview invitations coming in at the same time as being on rotation, and even having to I traveled for one interview during my away. But I would say personally for me, it was worth it. If you do end up in that situation, I shared my ERAS email, or the email account I was using for my ERAS, with the family members who could help me schedule my interviews when they came in. So that helped me be off my phone a little bit more. And the institution I was rotating with was really, I was nervous to ask about going for an interview, but they were actually very okay with it. The only trade-off was like I didn't want to miss very much time, but was able to just leave for a day, which felt okay. So for me, I was very interested in the institution I was rotating at, really was considering going and wanted to see what the fit was like, what it actually felt like. So I wouldn't rule it out, but just plan for it appropriately if that ends up being your only option. So going on to IR, preparing for the rotations itself, I'll start with IR. In terms of preparation and reading, there are a few resources I really recommend. I rotated about like 2 years ago at this point when a lot of the med student focused books hadn't come out yet. So really liked Kandarpa's Handbook of Interventional Radiology Procedures, as well as Interventional Radiology, a survival guide. However, a few books have come out since then, such as the IR Playbook and the Pocketbook of Clinical IR, which are more specifically geared toward medical students. So I would really recommend looking through these and looking at procedures that you know are going to come up often, like chemoembolizations or lines. So you're very familiar with the steps and have an idea of what you're going to see. Kind of going along with that, before your rotation, I would definitely try to talk to people who have rotated on it before to get a feel for what your department is strong in, what their experience has been, and what your expectations are. And then so you can help guide your preparation a little bit better. There are also some really good resources to help familiarize yourself with the angio suite itself. There is actually an RFS video of the tools that you'll be using in terms of wires and just getting familiar with everything you'll see. And I would also recommend reviewing anatomy that you're likely to see over and over again. For example, hepatic vasculature for chemoembolizations, as well as the abdominal aorta and takeoffs. As well as when you're getting access, looking at the carotid sheath or the femoral vessels, and just looking at procedure-specific anatomy, because you will get asked about what you're seeing, and also it just makes it a lot more enriching experience to be in a procedure and knowing what you're seeing. In terms of when you're on the rotation itself, my advice is really to jump into it and be enthusiastic. Definitely get there on time, have a positive attitude. In terms of what your expectations are, definitely the attending who's running the elective should make that clear, but I would also talk to people who have done the rotation before in terms of how much you're expected to follow patients, and just generally what's expected. I would look at the cases on the schedule ahead of time so you can look ahead and be familiar with the procedures that are coming, as well as so look a few days ahead and be able to prepare, or just a day ahead so you can, if there's something unfamiliar that you want to go into, you know about it. As well as, so in terms of the schedule, I've found that on my rotations, a lot is left up to students themselves to jump in. And sometimes you can feel kind of awkward, but I would say be confident and really familiarize yourself with the staff. Honestly, the techs are so helpful to get to know, and it's so great to be on like a friendly basis with them, both for like ease of being in the room, and they also give you so many tips, and as people were saying before, can show you how to set up the table, how to prepare different things that you're going to use. So don't be shy about getting in there, scrubbing in definitely, and introducing yourself to the people you're going to be working with. It helps to, I really liked trying to work with like all of the fellows and residents and attendings that were on, and kind of getting a feel for everybody's style, and then trying to spend more time with people who it clicked to work with and were really enthusiastic about teaching and would let you do a lot. And then I would say, I think those were my main things. And yeah, just forming a good relationship with people while you're on, being very personable and friendly, engaged, are all very important while you're there, because they're getting to know skills, your knowledge, but also really getting a feel for you as a person. The last thing is just in terms of clinic, definitely go to clinic at wherever you're rotating to get a feel for clinical IR and seeing patients outpatient and following them. As well as just doing procedures. Go to see consults on the floor if you're able to at your rotation. It just helps to get a much bigger picture of the role IR plays in the hospital and your patient's trajectories. And that can vary how much responsibility you can take depending on your institution. And lastly, definitely review cases before you go in, looking at their imaging that's already in the system so you know this patient's pathology and have a good idea of what's going on. In terms of DR, so I did our general intro to diagnostic radiology, as well as one GI fluoroscopy rotation, which is pretty different than a straight up reading room rotation. But I would say for my GI fluoro rotation, they did give us a textbook to kind of as a resource, and then we saw a lot of the same studies over and over. So if you know what you're going to be seeing, read up on what you're seeing. It makes it a lot more interesting. And when you get an opportunity to participate and engage with the attendings, really just like jump into it and learn as much as you can. I think other people honestly be able to speak towards more straight up DR reading room electives a little bit better. But I think the key is being engaged and trying to get as much out of it as you can. I would also add with the caveat of like having some social and personal awareness about like when are good times to ask questions, when things are like stressful and you should kind of like back off and make sure that the people, the attendings and residents or fellows doing the procedures can focus when they need to. But yeah, they're really great experiences, a great time to get to know your own institution, other institutions, to kind of see how the vibe of the department and the workflow can vary, and really get a feel of what you like and what you don't. So yeah, thanks.
Thank you. Thank you so much. Lauren?
Yeah, so I think Julia was very comprehensive, and I think it resonates with a lot of us who worked really hard at our home institution rotation as well as away rotations. I just want to emphasize the importance of being nice to everyone on your rotation. I think techs are your best friends. They're great teachers. Get in the procedure room early, learn from them about catheters and wires and all the tools in the tools of the trade. But also not to scare anyone, but away rotations are like a month-long interview, and I've heard this on the trail, I've heard this at my away rotation sites, and so make sure that you're treating everyone nicely, that you're working hard, be the first one in and be the last one out. Read not only the great books that Julia recommended, but also know about your patients. Be ready when the procedure is about to start, be there early and help the ancillary staff take the patients out of the procedure room as well. And I just want to add that there's always going to be a presentation that students are expected to give at the end of either at home institution rotation or an away rotation. Be prepared for that at least 2 weeks into the rotation, because that may be, like we as med students, we get scared for PIM questions all the time, but attendings, fellows, residents, they might not remember exactly whether you have answered something correctly or not in the long run. So this presentation, this 5 to 10 minute presentation oftentimes are the best way to show your academic enthusiasm for IR. So do prepare for that early and ask around like attendings or fellows for good tips on doing them really well. I just want to add a couple of more resources. I think IR Playbook is great. Pocketbook for IR, Clinical IR is great. I personally used IR Handbook for a long time because that's just been around for longer. But I also used chapters from or a couple of articles from the seminars. It's a more of a review journal for IR. I highly recommend that. It's very comprehensive for trainees. To get most out of clerkship, I think going to clinic is important for clinical IR, but also volunteering to go see consults inpatient and working them up is very important to show that you know indications and contraindications for doing a procedure. As IR is moving towards clinical IR, it's really important for students to understand when IR is needed and when IR is not needed as well. So I think volunteering to see consults and working them up and presenting those patients can really impress, can be very impressive on an IR rotation. Another recommendation that I got prior to my away rotation was meeting with the program director and also the chair of radiology when you're at the away site towards the end of your rotation. This is kind of strategic, just meeting, you will run into your IR program director on your away rotation, but to ask the program director to kind of set aside like in half an hour to just meet with you one-on-one for you to express, like your gratitude for teaching you for the whole month, but also like your interest in what you learned from the program, I think goes a long way. In addition to that, you can, if like for me, if the chair of radiology was an IR, I met with them, but if they weren't, I didn't. So you can be more judicious about the chair of radiology, but it's just nice to show your gratitude and your interest in the program. And in terms of getting a letter, this would be my last thing. In terms of getting a letter from your away rotation site, I think you have to be a little bit judicious. It's great. I think if you get a great letter, it works really well. But I've heard from many program directors that if you get a really great letter from one program, other programs may think like, oh, this person will probably go there. And I don't know, question your enthusiasm for their program when they're inviting you for an interview. So just when you use a letter from your away rotation site, use them judiciously.
Thank you, Lauren. And now, Jess?
Yeah, I mean, I think Julia and Lauren like really covered it, like everything that you need to know to do well in an IR rotation. So like there really isn't much for me to add, but I would say like things that really helped me, like at my home institution, like prior to the rotation, I was already like pretty close with a lot of the techs there, along with like the attending. So I think that helped, like the familiarity. Just to echo, it's really important to make sure I think you do your home institution rotation before you go on your aways, because like that familiarity will help you out a lot. And then when you go on your aways, you'll kind of already be there and you already know how to run the table and you'll be familiar with a lot of the wires and devices. And also just echoing, like read up on all your patients, always take a look at like the cases for the day after, and be familiar with that patient's history. And some places I know you can volunteer to present like your patient for the day, and I think that's good because it kind of gives you an opportunity to show what you know. And kind of echoing what Lauren said, like if they allow students to go and see consults, definitely volunteer to see one or two just to kind of be able to once again present that to an attending and kind of show them that you're like familiar with like the case and the contraindications and indications for that patient and have an understanding for like the clinical aspect of IR. And a lot of these rotations, like it's really what you make of it. You're never going to be like told to do like forced to do something or told to do something. It's really like the amount of effort that you put into it is what you're going to get out of these rotations. So definitely go into it, get there on time, stay there late, like show you're interested, enthusiastic, and I think that'll go a long way in kind of like showing them that you're very interested and passionate for IR. And in terms of like recommendations for like asking for a letter, I think you'll kind of, it's like a field basis. So I'm not familiar with what like Lauren said about like kind of like being judicious about using letters from a ways. But like you kind of gotta go by feel. Like if you kind of feel that you did really well, and you kind of see that whomever you're trying to ask for a letter of recommendation kind of sees that, then I think you should just go for it and ask for a letter. Like I would ask in person, and I'm sure like it'll work well if like you thought you did well and like you did do good work. So I think yeah, that's all I'd have to add to it.
Great, thank you. So it sounds like on a ways, no one really expects you to be an expert in IR, or at least the clinical perspective, but to show up and be present, be kind to everyone, read up on your patients, some things students really can excel at, to really make sure they're optimizing all of their skill sets where they can. So moving on, we covered some of this ground in our previous question, but if any of our panelists listed here want to answer the following questions: how did you decide at which institution to participate in an away rotation? Do you feel that an away rotation helped your application at a particular school or at a particular geographical region? And finally, any special advice for an away rotation compared to a home rotation? Malika?
Yeah, sure. I think there are different ways of choosing away rotation. Some people do aways in specific geographical region where they don't have any ties to open up doors in that specific area. And then some people, they do one or two prestigious program, one or two middle tier programs. And I think they're all great options. You can even do the combination of both. The way that I did aways at my dream programs, the places that I really wanted to interview, I really wanted to match and go there. So again, like as everyone else said, there's nothing like spending 1 month at an institution. You know, it's just like working interview for a month, which is awesome, but at the same time it's tiring as well, you know, because people are constantly judging you and then looking at you. But I would say that away rotation could hurt you as well. And I say this because I agree, you have to work hard, you have to be present, you have to be on time. But again, this is my personal experience, but don't try too hard to impress everyone and anyone by your knowledge. You know, it's just like you want to be someone that who people want to work with in future. Think about what kind of people you want to work in future. Maybe not someone who constantly want to impress everyone by how much you know. On the other hand, maybe someone who wants, you know, is just like impress everyone because you're nice to everyone, respectful to everyone. Again, like Laura mentioned, that like being nice from everyone, from chair of department to attending to resident, admins, like janitor, everyone's just like, you know, it's common sense. But like sometimes like I've seen like people being very nice to, you know, like attending program directors, but just like kind of like borderline disrespectful to admins. You don't want to be that person. And honestly, I don't know, like I did most of my aways in West Coast. I think like we are all lucky that's the culture in radiology, that everyone is very nice. But I felt like at the end of the day, they valued, like they were judging or looking more about the attitude and personality rather than just like the medical knowledge for me. And I really love that about the places that I did rotation there. The other thing is that everyone already mentioned about, you know, just like making sure you look up your patient. Again, it's just like about how much you're interested in learning rather than how much you already know. I honestly personally never got pimped about like any procedure, any medical condition. It was just like, you know, kind of like showing interest that I want to know, I want to learn. And I'm just going to emphasize on what Lauren said, that if you're doing a presentation, that's the time that you want to impress everyone. You know, that 10 minutes that they're going to give you, you have everyone's attention right before you leave. So make sure that presentation is just like perfect. And then the way that you can actually make sure that it's a great presentation is that whatever case you're presenting, make sure you go over your slides with the attending that you did the case with. And I was so surprised to see like how like helpful they were. Like one of the attendings that I asked to look at my slides, he spent an hour, you know, just like looking at my slides, practicing with me. So make sure you do that. Make sure you practice, and that's how you want to like impress everyone right before you leave.
Great, thank you so much for that, Malika. And before we move on to our next panelist, I just wanted to give two quick friendly reminders. The first reminder is We are taking questions. We'll be answering them at the end. So if you navigate to the GoToWebinar taskbar at the bottom, there's an arrow that says chat. And if you click that and please select SIR-organizer and panelist, we will be able to view your questions and answer them accordingly. And then secondly, we are so grateful to our panelists for their time and sharing all of their feedback. If you could please condense your responses to approximately 2 minutes to ensure that our listeners have a chance to hear you answer the great wealth of questions that we have prepared here today. I apologize that we don't have more time, and perhaps if there's something you want to expand later, we can find the forum for that. So thank you again to all of our panelists, and Caleb, if you'd like to proceed with answering the away rotations.
All right, yeah. First of all, I completely agree with everything Malika said. And so if I go over 2 minutes, just yell at me. But so I decided to choose University of Washington as my one IR rotation because my cousin found a very serendipitous interest in IR around the same time I did. And he had interviewed there and he liked the program, so I went. And I didn't have a geographical region of preference, and so that is how I made my decision. Do I feel like it helped my application or interviews? Yes, I had a wonderful subsequent interview at University of Washington. And I also interviewed at Daughter down the street in Portland, so it may have helped me get that interview as well. One thing I will say about my UW rotation is that, and this kind of goes back to one of Lauren's comments, when I was interviewing at a particular hospital in Boston, I was asked about what was the coolest procedure I've seen in IR, and I mentioned intraarterial chemotherapy for retinoblastoma. Which is a very highly specialized pediatric IR procedure, and not many hospitals do them. And so naturally, the interviewer asked, oh, well, where did you see that? And I said at my sub-I at University of Washington in Seattle. And immediately after, he asked, well, what questions do you have for me? And that kind of told me that I almost had wasted my time coming here after he had found out that I may be interested in going to Seattle as like West Coast versus East Coast. This may or may not be true, but it's definitely how I felt, and it's really no one's fault, but just be aware of this kind of thing may happen. And yeah, in terms of away rotations versus home, just learn at home and then try to, or do your best to show yourself in a good light at an away rotation.
Great, thank you for your advice and words of caution. Abhi?
Yeah, I would just add that I think if you're from the West Coast, or and there's like a lot of programs in your state, and there's a reason to think you might not leave your state, I think it's always helpful to do one out of state as an away rotation. I did that too, so I think that was helpful in opening doors, definitely in showing that I was willing to leave California, even though I didn't. But the second thing I would say is, oh, actually, I just forgot. But yeah, that's the main advice. I think everything else has been covered pretty much.
Great, thank you to all who really helped our listeners understand how to navigate some of the nuances of away versus home rotations. So we'll now move on to research. Were you involved in research, and if so, do you feel that it was helpful for your application? Do residency programs look for or expect conducted research to be specifically in radiology? How would a student identify and choose a research mentor? And do you think it is important for students to attend and present at conferences? I know this is a lot, so if you prefer to choose one and expand on it, or speak to all questions, please feel free. We'll start with Christian.
Yeah, sure thing. I'll try to attack some of these questions here. So yes, I was involved in research, a little bit untraditional research. Prior to starting my second year, I did complete a summer internship in biodesign engineering with the engineering department at my university. And I was involved in concept prototypes that have to deal with med technology. So really no publications came out of that. It was more just kind of this summer-long intensive program where I just learned this sort of industry and field. So really didn't lead to any publications per se, but it led to an interesting skill set that I acquired that later helped develop my interest in IR. So then, fast forward to third year, after a lot of the boards are done, you're kind of looking at your application and you're like, okay, what's left? And I think a lot of us run into that issue and you're like, wow, I don't have any publications or general research going. And so you run into that problem. And I found myself in that problem. And because my school was smaller and I didn't really have a dedicated department, I did need to reach out and cold email a number of local interventionalists in the area. And it did take some time to find someone, but eventually one of them responded and he eventually became my mentor for the rest of the year. And we did have a project together. So for those of you that are in any similar situation as that, I do get that struggle, and I would advise you to kind of stay persistent and do try to find a mentor, whether it's at your home institution or elsewhere, that's willing to take you on. And there are tons of ways to do this, whether it's one of those mentor searches on SIR's website, or either looking up some of the local hospitals around you and looking up their IR departments and see who's publishing regularly. Before you go and reach out to a PI, I would try to make sure you read some of their manuscripts before you contact them. I feel like this kind of helps you screen them to see if they're working on projects that you're interested in, and also get an idea of what kind of things they're working on, and what sort of their style is. And then when you do contact them, just open up the conversation and say, hey, I read your manuscript on X, Y, and Z. I found it really interesting. This point was pretty fascinating. I wonder if you have a brief period of time to meet up and discuss this experience. And perhaps this will lead to them letting you jump on a project and help out that way. Going forward, I feel like once you break that initial hump on getting on an initial project, it will become much easier over time to find additional projects to go on, whether it's with the same PI or just going to these conferences, presenting your findings or showing a poster. You're meeting other people, whether it's other students, other colleagues, other mentors, and they'll have a project and they're looking for someone, and that's your opportunity to jump on and be like, yeah, I'm interested in doing that. So, once you get over that initial hump, it will become much easier. Another tool, I know some of the panelists explained that they took a year off to do research. That's another great opportunity to do if that's something that you're interested in. Yeah, so.
Great, thank you so much. Julia?
Sure. So as I said, I did a research year out between my third and fourth year. But speaking toward the first question, just in general, I do think doing research is very helpful for your application. I feel like it did come up on interviews for me, and it was just neat to talk about your own project and your interests with IRs, because that's something that like they're interested in and could engage about. But in terms of whether it should be specifically in radiology, I did do a project in my second year that was a clinical research project in GI, and it was neat to get a feel for something like what clinical research was from early on. And after that, I still did want to do a project in radiology or an IR. I think it's just a really good experience for medical students, and shows a lot of ownership. And if you are going to head up a project in order to present and everything, doing it in the field you're going to go into is pretty useful. So in terms of finding and identifying a research mentor, I completely agree with everything that's been said, like looking up, well, I would say talk to residents as well as other med students about who might be good research mentors, and then also just look at their like bio sketches online and get a feel for their work, and then to email faculty about meeting with them. I'll talk a little bit about the research year and just the layout of research in general. I think in IR there is a broad range that goes from clinical research to translational to basic science. Personally, I studied engineering as an undergrad and really wanted to be on the more like innovative and technical side for my research year. So that was a really neat way to like learn more about that space and get experience with like different steps, kind of like somebody mentioned earlier, writing IRBs or IACOOK proposals, and really getting the chance to do this as a medical student when you have a lot of mentorship, when people are expecting to teach you how to do all of these things, from those steps to writing an abstract to present to a conference to preparing a poster or presentation for a conference. It's, as medical students, people are like very like happy to mentor us. So I really feel like I benefited from that. And then in terms of, yeah, lastly about conferences, I feel like just a product to show for what you've done is really helpful. It's really neat to get to go and to like meet and experience the IR community, and like show is the concrete thing that'll stay on your CV and show what you did. So I'm really loved the year, the chance to get to know more about like my project, but just like learn more about IR in general. It gave me a lot of face time with our department and to know what all was going on in the department, and highly recommend it. But of course, I do think it's not absolutely it's not necessary, but I do think it was an advantage for me personally.
Great, thank you. And Lauren?
Yeah, I think I can speak on behalf of someone who did not have as impactful research as like Julia did, because I've sat through some of her oral presentations and she's done amazing research at Penn. So I think publications, I've had publications from undergrad and first year of med school that are not related to IR. They were never brought up in any of my interviews. I think the projects that were brought up on my interviews were poster presentations and oral presentations that I did for various conferences. And I think it goes to show just my productivity and how I'm able to have enthusiasm for academic productivity and working on projects. But at the end of the day, I think it's much about the fit. If you want to be at an institution that does a lot of research and has a lot of, grant for research, then I think that's the route and that's your story that you should take. But for me, I am more focused on clinical practice and building and medical education and building my leadership skills in on a national and local level. And so much of my narrative for the interview cycle was about my leadership activities and where I see SIR activities going forward for me. And so I think it's also about the fit of the institution that you're looking for. And that's where I will leave it there.
I would also add a quick note that like the fit of, like Lauren was saying, fit's huge, and the fit of you with your mentor and which people in the department are really available and interested in mentoring and spending time with medical students makes a huge difference.
Great, thank you all for sharing your diversity of research experiences. So we'll now move on to the SIR Medical Student Council and other extracurriculars. So many of you are alumni of the Medical Student Council. Could you please speak to the role that the MSC played in your educational career? Was this experience something that came up in your residency applications and interviews? What advice would you give to a student who wants to get involved in IR leadership? And finally, what extracurricular activities were invaluable or important in your journey to IR? And I invite Lauren to start. For those of you who don't know, Lauren is currently the resident chair of the Medical Student Council and served as the president of the Medical Student Council last year.
Thank you for that kind introduction, Ilana. So MSc, the Student Council, as part of RFS, played a huge role for me in my application because I have been committed to the council and working with everybody, with the peers and also the mentors for the past 3 years. I joined after my first year, and I was part of the PR and communication committee and became the chair of it, and ended up as a chair of the student council. And I became more passionate about the work that I do every year because I became more acquainted with what we do and what we can do as students. I learned a lot from my peers because we're passionate about IR, but also different niche within IR. And I also learned a lot from mentors across the country. So it was a great opportunity for me. But with that came a lot of responsibilities, especially during my 4th year. You know, with all the responsibilities and also undeserving credit that I received for all the work that the Student Council has done, during 4th year, especially on my interview trail, I got asked tough questions like, what do you think is the future of IR? Or how did I balance the academics with 10 to 20 emails that I'm getting every day? And how will I balance that as a resident or an attending if I want to continue academic route? So I think, especially talking to my peers who are also on this panel, I've gotten some of these grandiose questions that maybe other students may not have gotten. So it was very important for me to get a grasp and be focused, grasp the understanding of where IR is headed as, student representative of SIR, but also have a better understanding of IR community, including research as well. So there were just a little bit of a expectation as representative of the student council on the interview cycle. But given that, I feel like I reaped more out of my IR community from this opportunity, more than the quote unquote tough times I had on my interview trail, because like I said, I learned so much from my peers as well, and we were all encouraging, especially during fourth year when we felt like we were overstretched with our schedules and expectations, and everyone was very understanding of project responsibilities during my 4th year as a chair. So I think there were definitely pros and cons to being in a leadership, and there were risks that I took, I think, and glad it worked out.
Thank you so much, Lauren. Deb?
Yeah, so I joined the MSc in RFS a little over a year ago, and I was able to get involved with the IO service line and also like the clinical education on like the RFS side. And I think some of the things that I took from that was just getting to know some residents and a lot of other medical students who are getting involved and like kind of going through the same thing that I was. And kind of the biggest thing I guess I took from my involvement were just those relationships that I made and continue to have with those people that I met. And I think this was something, I don't know like how like impactful it was prior to the interview, but in the interview it was definitely something that I was asked about and spoke with a few of the interviewers about my experience and some of the projects that I was working with in the 2 service lines that I was a part of. And I think it helped that I was involved because I was able to talk about it. And I guess my advice to a student that wants to get involved in IR leadership would be your experience is kind of what you make of it. I know a few people that like have gotten involved, but they haven't really taken part in that much. But like it's an opportunity for you to like get involved and like do some meaningful projects, get to meet and know a lot of people, and make those connections, and that can help you when you're applying in terms of like getting your name out there so people get to know you. And I think it can be very beneficial in that regard. But it is one of those things, like if you want to get involved, it's what you make of it, and it's the work that you put into it. So yeah, that's all I have to say about that.
Thank you. Malika?
Yeah, I completely agree with what everyone said, and I know we are running late, so honestly, like I don't have anything else to add, but I think like everyone else like basically covered it all.
Great, thank you to all. And just a quick plug for the RFS and the MSc. The application for the Medical Student Council did just close, but year-round, the Society of Interventional Radiology Medical Student Reserve section does accept rolling applications. So we welcome involvement throughout the whole year. And if you're listening and want to get involved, please check out the SIR-RFS website for applications to the Medical Student Reserve. So we will now be moving on to part 4, the application trail. And we'll start with letters of recommendation. How many LORs did you submit on ERAS? What was the medical specialty of the writers of your letters? How did these writers get to know you? And knowing what you know now, what is the most important piece of advice you could give regarding letters of recommendation? We'll start with Julia.
Sure. So I had 4 letters. I had one IR letter that was a clinical and research mentor, and he wrote to both of those areas. I had one DR letter that was a research mentor, um, and also somebody kind of senior in our department. I had a clinical letter from surgery, and that was actually my surgery clerkship, although I do recommend in general it being a more advanced rotation. And lastly, I had a DR clinical letter. So in general, my advice about letters is to definitely have one IR letter, one clinical letter, whether it's from like a medicine sub-I, a surgical sub-I, just something that says like you can manage patients um, well. And also a DR letter, as you'll likely be applying to both tracks. I would choose people who can speak to your strengths and have gotten to know you well if possible. So aim for them to be people you've done projects with, even if you've kind of just started it recently, but it's nice to have a personal relationship with them, or someone you've spent a good amount of clinical time with. Or so on your rotation, kind of think toward who you might want to ask and try to get good FaceTime with them. Um, you can also consider talking to senior med students or residents at your school, especially for DR for me, about like which rotations they recommended, because you'll get to interact with faculty more, or this faculty member is a good letter writer. Um, I think the most important piece of advice I would give is um, I think there's a big question about, do I do somebody who knows me well, or do I do a very senior person with a great name? I think that, like, obviously it'd be fantastic if you could have both, but I think a letter that speaks to your strengths and is personal is more important than a name.
Great, thank you. And Lauren?
Yeah, just 2 things to add. I agree with, well, Julia, about getting a recommendation letter from somebody who knows you better than just the quote unquote famous person in your IR department. In addition to that, I think especially for diagnostic radiology, I've been told that it's important to diversify your letters. So I've had 2 IR letters from home, 1 surgery, 1 DR, and I added in medicine whenever I was applying into medicine intern year. And I also had 2 away rotation letters, but I used them judiciously, as I mentioned before. In terms of diversifying the specialties, I think from my DR advisor, he was very disappointed that I didn't get like a legitimate, really awesome medicine letter, because the medicine letter that I got was kind of just for prelim. And maybe he wanted me to get like a family medicine or some other specialty other than surgery or IR that almost said something like, wish she would go into family medicine because she's so great, or something like that. But honestly, I didn't think it was such a big deal for my DR application, but that's just something that I've been told, the feedback that I got. In addition, I think if your institution has an IR program, then you should definitely get a letter from your IRPD. I think I don't know if the panelists would agree or disagree with me, but I think it would kind of hurt you if you do not get a strong letter from your home IR program director, because IR is such a small world. Everyone kind of trusts each other's words. So work hard at your home institution rotation and definitely get a great letter from your home IR PD.
Great, thank you, Lauren. Jug?
Yeah, so I submitted, I think 5 letters to ERS. So I had 2 of my IR mentors write me one, and they were also my research mentors. And then this one diagnostic radiologist that I'd worked with during my clerkship and like kept in touch with after. And then I did 2 kind of clinical letters, one from one of my psychiatry attendings that I worked really well with, and then one from one of my internal medicine attendings. So like I said, these writers got to know me through a variety of different ways. Like my 2 IR mentors got to know me since like I first got introduced to IR, so they got to know me pretty well. And then my other 2 clinical letters, they got to know how I worked in the hospital and how I kind of worked patients up in like my clinical knowledge. And I think having that variety was pretty good. But the biggest thing I think was that they all like got to know who I was pretty well, and they could speak to that like in their letters. So it wasn't kind of like a bland letter, which you could get from someone who might not know you as well. And I think that kind of helped. And I think that's one piece of advice I'd give to people is if you're like choosing between getting an IR letter from someone who's super well known, but you may have only worked with him like a handful of times versus someone who knows you very well, I think I would go with someone that knows you really well and can write you like a strong letter and kind of speak to your like true qualities and true strengths. And I guess yeah, that's my advice when asking for letters. Get it from someone that's gotten to know you and seen like how you've worked and knows your strengths.
I would also quickly add just the importance of letters. I feel like they carried a lot of weight in the process. Like people brought up my letters a good deal, and I feel like even hearing from PDs, and I'm not sure if in that paper, like just hearing about like the quality of the person, and especially as it is a small world, those seem to speak louder than your personal statement for a residency.
Wonderful, thank you for adding that, Julia. So we are going to move on to personal statement. In the interest of time, we're going to have one speaker, one panelist per question set. The feedback is so valuable, and it kills me to cut our panelists short, but I'm hoping that anything we miss will be asked in the question session at the end. So for these questions, Malika, knowing what you know now, what is the most important piece of advice you would give regarding the personal statement on ERAS? And did you or would you recommend writing distinct personal statements for IR-DR residency programs versus DR residency programs?
I think for personal statement, it's important to have 3 things in your personal statement. 1, obviously, why do you want to do IR and radiology? What do you bring to the table? You know, the skill set that makes you very good resident, radiology and IR resident. And finally, what are you looking for in a residency program? More of like speaking your long-term goals and what you're trying to get out of the this training program. And I think it's important to be personal and detailed, and then back it up with stories that help the reader to learn about you and believe what you're saying. For example, like it's one thing to say that, okay, I want to be a leader, or I want to like do academia, and it's the other thing, just like kind of like back it up with the stories, the projects you've done, and then what you've learned from it. If there's like any specific story about like if you failed something, what you learned from it, and then kind of like use all that to convince the reader, okay, that's how, like, that's what it's gonna make me like a very competitive applicant and an amazing resident. And that's how it's just like, to me, it's a difference between like a good personal statement and very impressive personal statement. In terms of like the IR and DR personal statement, I initially wrote a personal statement for IR application in which I focus on my interest in both diagnostic and interventional radiology. And for my DR application, I kind of like try to only focus on the DR part and then, just like delete the IR, the parts that were just like very IR focused. But with that being said, I feel like in the IR personal statement, it's still like a good idea to talk about your interest in diagnostic radiology and in radiology as well, just because you're still applying to radiology. Like, for most program, the assistant program director for IR is the PD for the DR. You're gonna interview for your IR interviews, you're gonna interview with the PD of the DR program. So you just have to make sure that you can convince them that you are interested in radiology, IR, and DR, because like the 3 years of your training, even if you don't want to practice DR in future, the first 3 years is just like diagnostic radiology, and you don't want to, just like kind of like leave the impression that you're not gonna make a good diagnostic radiology residence. And that's why I would just like still spend time in my IR personal statement to talk about your interest in diagnostic.
Great, thank you. And you did a great job of answering both questions, but particularly the last, which I think poses a trickier, hairier situation to many applicants who are trying to straddle that, navigate that challenge. But you did a great job of showing how students can maintain the integrity and be true to themselves in their personal statements, but also kind of highlight features of IR and DR in both. So thank you. So moving on to other advice for the ERAS application, is there anything else you wish you had known when you were preparing for your ERAS application? Christian?
Yeah, so as far as ERAS goes, number one rule, make sure you get everything done on time. It really comes by so quickly, especially when step 2 rolls around and you're getting ready to travel for your away rotations. That early September deadline rolls around pretty quickly. So try to have everything in as quickly as possible. I'd say the hardest thing to get in on time is those letters of rec. Don't be surprised if you run into the issue of asking a letter writer in, let's say, September the year before, and you don't hear back from them until June, July, and you just gotta periodically remind them. It is quite a hassle, but it's something that you need to be organized and stay on top of. As far as that, same thing with your CV. Many people's schools have different services where they get editors for your CV. Make sure you get a number of people to take a look at your CV, get a different perspective before you eventually submit a final draft. People have different strategies as far as step 2 goes. I personally would recommend taking it early and even before, so you could have it ready to go submit for ERAS. Just so you have everything completed and you don't leave any room for ambiguity for the programs that are reviewing your application. I know we talked about the personal statement. Really, the only thing I'll add with that is I know my school was pressuring us to try to complete it by March before the cycle started. However, I chose not to follow this advice. I really waited till about 3 or 4 weeks prior to the ERAS release date. Mostly because of my own procrastination and step 2 prep. However, looking back, I found that this was really a smart decision, mostly because my understanding of IR as a whole and why I truly wanted to enter the field was significantly more profound in July, August time than it was in March. So, don't be afraid to hold it off a little bit. And I think if you do, you might actually find it easier to write at a later point in time when you, a little bit more well-rounded and understand the field more. A little silly, more minutia sort of things as far as the ERAS application goes. I got a professional editor to review my personal statement. I know there are a number of these services out there. Some people use their school. I found one online. It was called ServiceScape. It was extremely affordable. The turnover was 24 hours, and they have thousands of professionals on their website, and you kind of search through it, and they have a whole section of people that edit medical-related literature. So I loved it so much, and I was very happy with the outcome. I even ended up using it for a later manuscript editing, and they're very skilled at meeting word requirements, especially for that limit you have on the ERAS application. And then lastly, it sounds silly, but I felt that it was important that I got a professional headshot taken by a skilled photographer. I just felt that it just completes a crisp application and makes it all around. It's kind of that little cherry on top, and you'll actually be surprised on how often your picture gets shown up on these interviews and during the interview day on these PowerPoint slides and these paper handouts. And plus, you'll just have them forever. It's a nice thing to have. So for those of you that are in the NYC metro area, I use a place called City Headshots, so that's something you could look up and email me for more information.
Thank you so much, Christian, for covering so much ground there, from headshots to letters of rec and updating CVs, all really important facets to the application.
Sorry, can I just add one more thing that may not be obvious to everyone that I was recommended to do? So I was recommended to apply to all DR programs at the institutions where I was applying for IR. And that is because IR program directors want to know that you're that enthusiastic about their program that that you would like to go to their DR plus ESIR if that route is a possibility as well down the road. So I was recommended to do that, and one of my friends who only applied to IR programs actually was recommended to apply to their DR program at his interview. So it's a lot of money, but I highly recommend that.
Thank you so much, Lauren, for jumping in with that. So now we'll move on to choosing which residency programs to apply. How many programs did you end up applying to in IR/DR, other specialties? For each program to which you applied, did you apply in both IR and DR? In your opinion, how should an applicant determine to how many programs to apply? And what was the most important to you when you were deciding to which programs to apply? Doug?
Yeah, so for me, this might be a little bit different because so I'm actually a reapplicant this year, and I'll go over more of that I think later on towards the end of this slideshow. But so like when I decided to choose how many programs to apply to, I applied to I think almost all of them because I wasn't really sure if there was going to be like a filter for like a reapplicant or not. So there were like a very few programs that I didn't decide to apply to, and those were mostly because there were like very few regions in like the US where I was like I don't see myself living there for 6 years. So for me, like deciding like how many programs to apply to, it's probably going to be different than for like a lot of other people that went through the process. In my opinion, how you should determine how many programs to apply to is kind of getting kind of like an honest assessment of your application from your home institution's program director, talking to upperclassmen that have applied and having them take a look at your application as well because they've been through the process, and basically telling them to give you like an honest assessment. Don't like sugarcoat anything, and that'll like kind of best give you an idea of how many to apply to, I think. And for me, like I said, that last question, like I ended up, I just wasn't sure like what would happen with the reapplication process, so I ended up applying to almost all of them.
Thank you so much for sharing your wisdom and also about the process of application and reapplication, which if you would like to share more with, we look forward to hearing later. So we'll now move on to after ERAS and before interviews. Lauren, how soon after submitting the ERAS application do applicants seem to hear about interviews in IR and in DR? Did you have or would you recommend any contact with residency programs between submitting the ERAS application and receiving an interview invitation? And what were the most important differences between IR and DR interviews? Any specific advice to approach the DR-IR straddle in a forthright but strategic way?
Yeah, I would like to share this question with Caleb as well, who decided to go with the DR-ESIR route. But just to answer a few of the other questions, I wouldn't say that early October is probably the earliest the IR interviews will start coming out, and then it'll just be sprinkled throughout until like end of January or early February, if you're including some of the prelims as well that come out later. So that's the timeline for the interviews. If you receive an interview, you don't need to contact them unless you want to reschedule. Don't reschedule interviews too frequently, especially at the places that you want to go to. It just kind of goes to show that you're trying to prioritize like another program, and it never looks great. And also, I just want to say that it's like an etiquette to be kind about canceling at least 2 weeks ahead of time to allow, other people who could really appreciate the interview spot to have that spot on, so just have that etiquette during the interview cycle. And you also don't want bad blood with any program. Like I said, IR is a very small world. In terms of IR versus a DR interview, I felt like DR interviews were more chill. Like I said, I studied film in undergrad, so I ended up just talking about movies and recommending movies to a lot of my interviewers. And I cook a lot, so I talked about my cooking as a hobby. For IR, like I mentioned before, I got a lot of intense questions about, the future of IR and, where SIR is headed and everything. But I just basically at a baseline got questions about, why IR, what I love about IR, which procedures are my favorites, and, anything on my CV, was a fair game, like research, leadership. And I think it's a great, I think everyone needs to practice how to answer some of the highlights from your CV. It's great to start off like the, one sentence line of what you learned from that experience, but also have specific examples of what you accomplished with, kind of like elevator speech for specific activities in your CV. And Caleb, if you want to follow up with some of the things that I said about like IR versus DR interviews, please feel free.
Yeah, no, I completely agree with everything you've said, Lauren. And yeah, as the anomalous applicant who did match DR, I did feel that the diagnostic, or to be clear, I interviewed for interventional radiology, and the program that I matched at was also, I matched off of an IR-DR interview. So I applied for both at Emory, and then I, was able to match into diagnostic there. And that's kind of how I did it for all of the other programs as well. But yeah, definitely agree with DR interviews being a little more relaxed, and then IR's a lot of times straight to business.
Thank you so much to both of you for sharing your perspective. So we're now going to move on to interviews, all about interview prep. And Abhi, if you wouldn't mind answering the following questions. For the IR program interviews that you attended, was there usually an integrated formal DR program interview? For the DR only program interviews that you attended, compared to an applicant applying only in DR, do you feel that your interview experience was somehow different? And what are some common interview pitfalls that cause applicants to leave a bad impression?
Yeah, so I can, just for the first two questions, for all my interviews that I went on, they were always broken down with, you either do your IR interviews in the morning or afternoon, you do DR interviews in the morning or afternoon. So a typical day might be you get in, you get breakfast, then you might start with your diagnostic radiology interviews, have lunch, and in the afternoon you meet all the IR people for those interviews as well. If you're only interviewing for DR, then you might just leave after lunch. If you're doing IR, then you stay for the afternoon as well. When you're interviewing, let's say you're applying integrated IR, generally you're also applying for diagnostic radiology as well, so that when you make your rank list, you can rank that however you want. We can talk about that later. But the people that are interviewing you for DR know you're also applying for integrated IR. And for me, at least, I felt like they didn't treat me any differently at all. I there were moments to speak about a passion for diagnostic radiology, and there were moments to speak about a passion for interventional radiology as well. So I truly felt there was no difference. Common pitfalls, I think it kind of goes back to the ways too. I think it's super important to, just like when you walk in and you meet everybody, you just gotta, just be happy, be nice, be grateful that you made it there. And I think that gratitude shows in the room as well. I think, don't be the person that throws others under the bus. Don't be arrogant, always be hungry and humble. I think that, when sort of negative moves like that are made, you can start feeling it in the room and people see things. And even at SIR this year, Dr. Fishman, he's the PD at Mount Sinai, was talking about how he, one thing he looks for is that people just get along when they come in and sit at the table and they start hanging out before people get, called in for interviews, and he sees that as a positive thing. So I think it's just coming in happy, grateful. It's a long journey and process, but I can say that even on this panel, I feel like I've met a majority of the people on this panel already. So it's been a really fun time. So just try to enjoy yourselves and have a good time.
Thank you so much, Avi. And now for interview day part 2. What types of interview questions are guaranteed to come up? What was an interview question that surprised you? During an interview, what can applicants ask or do to best assess whether this residency program would be a good fit for them? Julia? Julia, if you're speaking, you might be muted.
Thanks. I was muted. So I agree with everything Abhi said about the interview day being very friendly and about just experiencing the whole day and leaning in and fitting in and feeling it. In terms of the interviews themselves, I feel like most of my IR interviews were very conversational and very casual. Some of the interview questions that definitely did come up over and again were what brought you to IR and why you're interested in IR. I think also you're likely to get what are you looking for in a program and why this program. I also a few times got questions about more interviewee questions about tell me about a challenging clinical scenario or tell me about X kind of scenario. So if you prepare some blurbs from or think about different experiences from a sub-I either on IR or your medicine or surgery sub-Is that you can talk about. I drew from some recent clerkships there or rotations there. Interview questions that surprised me were actually some of the personality ones, which ended up being pretty fun. I got asked about my spirit animal or about things like that. They weren't necessarily as intimidating, but they did kind of put me on the spot. And I think maybe they, I actually got told once after that they just wanted to see how I would do on the spot with something surprising. But I think the interviews are very low stress. I would focus on connecting with your interviewer and really just having a good conversation. It's a great opportunity to talk to some really cool people and find out about what they do at their institution as well as get to tell them about yourself. So to assess whether it's a good fit, I really, a lot of people say what your gut feeling is on that day, and that's something that I think is hard to assess from one day, but you do feel a difference between different programs. I liked seeing places where the residents were really friendly, where it seemed like there were good interactions between faculty and trainees. One other thing that was important to me was to look at how hands-on or hands-off programs were in terms of teaching skills. And I personally want a good mix of making sure you're doing things very technically well, but also giving you opportunities to do things yourself. People also talk about when you're on the tour, take a look at their board, see what kind of cases they're doing. Think about the caseload. If there's a specific area you're interested in, do they do a lot of that procedure? Are they very clinical in terms of clinic consults? Are you going to be learning that clinical IR? and just like talk to the residents a lot. Like I really liked going to the dinners, to be honest, because it did give me a better feel for the program that I remembered better and was more casual.
Thank you so much, Julia. It was fun to hear about your surprise questions, and also liked your advice about being armed with handy stories and clinical vignettes to answer some more abstract questions.
It just adds, I know we're running late, but one other thing that was personally important for a good fit was like research opportunities. Okay, so we can continue, sorry.
No, that was really important, thank you. And speaking to the note about time, I do apologize both to our panelists and to our listeners for running significantly over time. I know we were slated for 60 to 90 minutes. So I want to remind everyone that this webinar is being recorded, particularly to those of you on the East Coast as it inches closer to midnight. You can tune in later when we upload this webinar to the RFS website, YouTube channel, so not to worry. So continuing now with the post-interview and ranking, Caleb, if you would mind answering the following questions. Did you have or would you recommend any contact with residency programs between your interview and the submission of the rank list in February? What was the most important to you when you were deciding to which programs you would rank most highly? And do you have any advice for applicants regarding the rank order of IR-DR programs versus DR-only programs?
All right, so post-interview communication, I really think the only necessary email is an email to your number one after you've put together your rank list at the end of the season. I sent a few thank you letters, but it really didn't feel like it. If I were a program director, I really wouldn't want some extra communication. I think you take what you felt on interview day, and they weigh you on interview day. I don't think any extra communication is going to help you. It may only hurt you, in my opinion. And then what was the most important when I was deciding on ranking? So for me, it came down to a lot of feel. Reputation of the program was important, and procedural complexity and volume. I weighed pretty hard against any kind of pretense, and that kind of goes to feel. And then location kind of came in the end for me. But if I had to do it again, I would do, or I guess I would contrive some kind of standardized scoring system where feel gets 10 points, reputation gets 10 points, or like 0 out of 10. Location is weighed 0 out of 10. And then kind of have that as a foundation when you go into making your rank list at the end of the several months of interviews. So it can kind of help guide you make that final decision. I didn't have that, and that's something that I think probably would have helped me, or at least comforted me making my list. And then finally, rank order between IR-DR or DR only, I think it is contingent on your goals. I think it's a little bit of risk versus reward. Matching into diagnostic radiology, it's a little more risky. And it's a little bit hubristic of me to think that I will get into an ESIR spot. Matching directly into the IR-DR pathway, you have the security of your IR residency already, whereas I still have to work to earn mine. The one thing, another redeeming factor about the DR pathway is that it offers potentially a greater training opportunity, wherein you can train at more than one institution. Potentially, you could do your ESIR year at your home institution, and then go elsewhere to look at another program, learn a different means of IR practice, where they may do different procedures than you or in a different manner.
Great, thank you so much for that. Particularly liked your point about developing a standardized quotient to help with decision making regarding ranking. So we'll now move on to this really great question, which was suggested by one of our panelists. Malika, what were strategies or activities that you used to support your happiness and wellness amidst the competitiveness of the application process? In other words, how did you enjoy your fourth year?
I think that's a good question, but honestly, I don't know the answer for that. I'm kidding. I think to be honest with you, fourth year is just like both stressful and exciting. A lot of traveling, constantly meeting new people, which is wonderful, but at the same time, it's tiring. You have to have that smile on your face like all day during the interviews. But again, I speak for myself. I think it was just like a humbling process. I got rejection. I got like really awesome like interviews, had a good interview day, bad interview day, like got sick literally the day before my presentation on my aways, flights get canceled, anything that you can think of. But all I can say is just like try not to overstress yourself, because by nature it's just like a stressful process. The whole interview season, like applying the ways. So try, because people understand, program director, program coordinators, they understand like anything happens with the interviews, they have to deal with this whole process every year. So just like, again, like don't overstress yourself, and however you just like de-stress during medical school, continue doing that. If it's just like doing yoga, watching Netflix, it might be a little bit hard to work out during the interview season, but continue doing that. I don't know, it sounds stupid, but honestly for me, especially during the OAs and interviews, every time I had like few people around me that they would still take my phone calls, I would just like call them and then start like, complaining and venting about the whole thing. Like, oh, I said this, I feel like so stupid, I was nervous. But after that, it's just like kind of like move on, because everything's kind of like normal and very part of the process of like the whole fourth year. So I would say just like celebrate small victories and let go the failures. And however, I hated when people told me like at the end of the day we'll work out, just like trust the process. And I was like, that's impossible. But just like trust the process and try to make the most out of it.
Thank you so much, Malika. It was a really inspiring message that you shared about being true to yourself and finding healthy ways to vent and move on. Everyone makes mistakes. Everyone learns from them. They're really just opportunities. So I really appreciate your insights on this question. For our next question, I just wanted to give all of our panelists the opportunity to share a quick bite or a piece of advice that they've kind of been burning to share this during this whole session that they haven't yet had the opportunity to share. So kind of a free-for-all before we get to our final question and take questions from the audience.
So I will say, I think the one important thing for interview preparation is just some introspection. If you really know yourself, you're going to be able to tackle almost any question they throw at you.
I have a quick addition I can make. I would say for your personal statement, it's important, don't just list your CV. I think it's important to, it's important to definitely describe obviously why you love the field and definitely a vision for yourself. But if you can tie that into something unique about yourself that's not necessarily on your application itself, I think that can be a great conversation starter, especially in interviews, and gives you some additional depth in your application. So I would just add that.
I actually would add to that as well. I completely agree. If you can take a characteristic, something unique about yourself, and harmonize it with IR, like how it led you there or how it makes you fit into IR. For me, for example, it was a communication motif that started in Japan, kind of led to some kind of self-expression in me playing the violin, which led to precision, which led to me being an interventional radiologist with precise, nimble maneuvers. And at the end of it all, the reader has this personal story about why you're going to be a stellar IR. And I think that's incredibly important. And if anyone wants guidance or on a template for a personal statement, you can just email me.
And then last thing, sorry, one thing, I think we may have skipped the slide on choosing an intern year, so I just want to add my tidbit on that. But so your options are essentially, unless your program is categorical, which generally, if it is categorical, you'll probably do a surgical year at that institution and then transition to the DR and IR aspect of things. But if you're doing an advanced program, meaning you have to select and apply for your own internship year, your choices are amongst a surgical intern year, a medicine intern year, or a transitional intern year. I applied to surgical intern years. I thought that was the best decision for me. I came to this decision just listening to my mentors. They know the field, in my eyes, far better than me and know where it's going. And so I listened to their advice, and then I explored it myself. And I think what it came down to is for IR specifically, there's a lot more overlap with surgical communication as well, in regards to especially the higher level cases that start happening. Understanding how to manage a patient post-operatively is very important, especially as IR moves towards more of a clinical discipline. So and also as a surgical intern, you're going to be reading a lot more diagnostic radiology that's going to help in you making an important clinical decision, maybe even prior to the official radiology read that comes out. So I think you'll get a lot more practice in DR. You're going to get a lot more practice procedurally, and you're going to get a lot more practice managing patients before surgery, during surgery, and after surgery, which I think has a lot of overlap with IR in general.
And I just want to add to that really quickly. I had opportunities to speak with some of the founders of IR Integrated Residency, and they really envisioned the integrated residencies to parallel with training for surgical subspecialties. So understanding that, and exactly what Abhi said, understanding the importance of, quick pre-op and how to make, quick clinical judgments, and also spending a lot of time in the procedure room and also following up with patients outpatient. I think there's a lot to learn from our surgical colleagues. So I'm going to a categorical program at Georgetown where I'll be doing my surgical intern year and then following up with the rest of my training at Georgetown. I think another benefit to doing an intern year at your residency institution is that you'll get to know the EMR program, so you don't need a lot of time to understand it when you're starting your residency, but also you get to know your surgical colleagues who you will get to talk on the phone and have consultations with even during your diagnostic radiology rotations. So yeah, I think surgical intern year is valuable, especially at your home institution. In addition to that, just I think I applied to way too many prelim programs. What I realized is that even though an IR program is not categorical, a lot of programs will provide a linkage. So if basically it's kind of like if you get into their IR program, you do have the option to just get into their it's usually a prelim surgery program at that institution. So if you want to spend money on applications, I think that's where you could save money. Oh, I meant to say, yeah, save money.
Great, thank you, Caleb, Abhi, and Lauren for all of that wisdom. We're going to move on to our final question here, unique characteristics and experiences. So you all have interacted with many other applicants on the interview trail, but there is no single typical residency applicant. Could you describe a unique characteristic of your background or experience that affected how you approached the application process? And we'll start with Caleb.
Yeah, so I guess I'll talk more about my experience. And to expound a bit, I interviewed with mostly IR programs, so I applied only to IR/DR programs. And then in the end, I ended up ranking diagnostic radiology as my first rank, and then that's where I have matched. And my reasoning is that, to me, the IR portion of my training is the most precious, I think, that I'll probably have in my medical training. And so for me at the time of these IR interviews, it was a little bit difficult to assess, the integrity of a program, because or at least to ascertain the integrity of a program on a simple interview day, because there's so many behind the scenes, things like how hands-on is it, what's the case volume or complexity, how's the relationship with the surgeons. At this time for me it was a bit difficult. I was more confident in my ability to choose a very good diagnostic radiology program, and that's why I went ahead with that. With the fear of falling into some suboptimal interventional program. Radiology already in itself being a highly specialized field, for me it was hard to assess without diagnostic radiology foundation how good the IR program could be. And I don't know if anyone else felt similarly, but that's kind of how I came to be the only diagnostic or matched applicant on the podcast.
Thank you so much for sharing that, Caleb. Christian?
Yeah, so I'll try to keep this extremely brief, obviously because of time. But yeah, I mean, so each one of my colleagues that I've met on the trail, and obviously every story you've heard so far on the panel, each one of us has a number of interesting characteristics and a background story. And I think that's one of the strongest reasons why I love IR and how unique everyone is and how we each got brought here, and each one of us brings a different element to the table. So at least for me, I felt that my background in engineering helped a ton as far as this application cycle went. I had a little bit of an engineering background in undergrad, and then when I got to medical school, I found out that there's all these different unique opportunities to combine my experiences in engineering during medical school. So I did do a summer internship in biodesign and engineering, and that's when I fell in love with medical technology and the culture behind that. And that would give me the opportunity to innovate and help patients on a more macro level scale than as opposed to in the clinic and in the OR. And then later, when I found IR had a huge footprint in medical technology, this made an even easier decision for me, because now I was able to combine my passions for medicine and engineering into one specialty in a sort. And then later, I eventually got involved in MSc, and I partook in the biodesign competition that they had 2 years ago. And then later, eventually joined the council for this year. And it was just an overall good experience to work with my teammates and collaborate on that this year.
Great, thank you. And Judd?
Yeah, so for me, so I actually had applied for the 2018 match, and I didn't end up matching. And so I ended up being a reapplicant for this cycle. And I kind of, I guess, added to my background or experience, and I think it helped me during this cycle, because prior to, I guess, like 2018, I met with my advisors and everything, and I think like what I did was I kind of limited myself in terms of where to apply, and kind of using their advice. And I think there was a huge bump between 2017 to 2018 in the competitiveness of radiology. It was getting more competitive, but I think there was a bigger spike in 2018. So kind of the advice that I'd gotten prior to that application cycle didn't really apply to that, what actually happened during that cycle. And I think speaking with people after the match, that kind of figured that that's what caused it. And I kind of looked at it, and I decided to do a research year with my home institution, and I decided to kind of go, I guess, all out for this application process and give myself like, I was gonna call this like kind of like my one last like kind of opportunity to see if I could get into like interventional radiology or diagnostic radiology. And for me, it was gonna be fine, because I knew if I didn't get it, I did everything I could. And so I would have been fine with the outcome. But so what I did is I kind of worked with a lot of the faculty at my home institution, and luckily my home institution also has an integrated residency, so I got to know everyone a lot better. I was able to be productive and able to like kind of always be around the Angio suite throughout the year. The way I kind of worded it, I was honest in my personal statement, and I think honesty is like kind of the best policy. If someone else is like in a similar situation, just address it in your personal statement in a couple of sentences, what you think happened, why it happened. And I think that kind of helps, like when they kind of look at your application, they see that you didn't match, that you kind of addressed it and were honest about it. And then this year ended up being kind of a better overall year because a lot of what I was told my first go around with certain things that people told me was just like, oh, no one really like looks at personal statement that much, like and all these different things. Like I kind of spent a lot more time on like every part of my application, and it paid off for this cycle. And I guess my advice is, if you really want to like go into interventional radiology and you kind of have like that commitment and passion like throughout your application, and you have people that you've worked with that can attest to it, I think someone will give you that opportunity, and you should keep at it. And I think everything happens for a reason, and it kind of works out in the end. And so I'm ecstatic this year. I'll be able to stay in Miami. So for me, it all worked out. And if anyone has any questions about the reapplication process, they can always reach out to me like individually. I'd be happy to answer. Thank you.
Thank you so much to all of you for sharing really personal details of your application journey. I know our listeners are grateful, and your insights are invaluable to their journey, so thank you so much. And with that, we're going to complete today's webinar with the Q&A. I think there might have been some technical difficulties because we did not receive any questions, so we greatly apologize if your questions were kind of lost in the virtual realm. But we will be sending out an email through SIR Connect with the email addresses of today's panelists. So you will have an opportunity to answer your questions and to direct them to a specific panelist. And I'd like to now wrap up today's Competitive Applicants Panel 2019. First of all, thank you so much to all of our listeners for hanging around so late. Again, I do apologize to everybody, panelists, listeners, for going so late into this evening, but we really appreciate you tuning in. A special thanks to all of our panelists who were so open and generous with their knowledge, their experiences, their insights. We know you're amidst a really stressful and a big transition in your lives as you approach graduation and prepare for big moves and new apartments and internships. So thank you so much for making the time to sit here with us this evening. A special thanks to Lauren Park, one of our panelists, also the resident chair of MSc, who was really instrumental in helping me plan today's webinar. Everyone who's had the privilege of working with Lauren knows that she's really inspires confidence and has done an extraordinary job leading the charge at MSc. And she's not only been a pioneer of leadership, but has also been really passionate about mentorship and inspiring underclassmen. So thank you to Lauren. Thank you to Jason Fisher and David Bamshad for assisting with webinar planning. Thank you to current MSc Chair Hansen and to the MSc chairs for help with webinar planning and advertising. Another thank you to Sana Hairwald, former chair of the Education Committee, for her help in preparation and for sharing her 2018 slide set. This meeting was recorded for future viewing by students unable to attend the live webinar, and it will be posted on the RFS YouTube channel. Again, thank you for joining the meeting, and you'll be hearing us through SIR Connect with today's panelist email addresses. Have a great night.
Thank you so much, Ilana.
Thank you.
Thank you.
Thank you. Have a good night.
Thank you, guys. Thank you, Ilana.
Thank you.